Hi, Dr. Happy here. Most of you have confusion in selecting the proper toothpaste and mouthwash because nowadays a lot of products are available in the market. So, according to my opinion and my patient feedback, I would recommend some products that will help you to maintain a good oral hygiene. Nowadays, most of us are having sensitivity to the tooth. That can be due to the frequent use of acidic beverages that cause the enamel erosion as well as the abrasion. This, in turn, will cause a sensitivity to cold. So, in such cases, in mild cases of sensitivity, you can use the Emoform sensitive toothpaste, and in moderate to severe case, you can use Emoflour intensive care gel. The toothpaste you can just apply on the surface of the tooth and you can just wait for 1 minute and then you can do your brushing. And as well as the Emoflour gel, you can just apply on the tooth surface and don't eat or wash your mouth immediately you apply the gel. Actually, this desensitizing paste, this will form a layer on the surface of the tooth, and that will block the nerve endings in the dentin and will prevent the transmission of the pain to the deeper layer. This won't happen in a day 1 or 2 because it will take time. So you have to use the product continuously to get a better result. And many of the time, my patient used to come to the clinic and say that I'm having discoloration on the tooth. I'm using the mouthwash regularly. So maybe you are using the mouthwash that contains a chlorhexidine that will cause the discoloration of the tooth. Because the main disadvantage of chlorhexidine is it will cause stains or discoloration on the tooth. So I would recommend to use of Tebodont mouthwash. It contains the tea tree oil, and the main advantage of this mouthwash over the other mouthwash is this won't cause any discoloration or stains on the tooth surface even if you use continuously. And as it contains the tea tree oil, it can be used in case of mild gingivitis, irritation in the gums, and it will reduce the inflammation. And it also contains a sodium fluoride, so it will help to prevent the dental caries too. And Tebodont toothpaste as well as the Tebodont gels are available, and the gel you can just apply on the irritation, apply on the gums which is getting irritated or as because of deposits, as well as bleeding gums, and you can apply on the surface of the mouth ulcer. And in case of mouth ulcer, if you apply the Tebodont gel, it will reduce the inflammation and reduce the pain, and it will fasten the healing of the mouth ulcer. And for kids, I would recommend to use a fluoridated toothpaste. And many of us are maintaining a good oral hygiene, but still we are more prone to dental caries because of genetic reasons or maybe because of diet. So in such cases, that is the patients, those who are more prone to dental caries, I would strongly recommend to use the Emoform Protect toothpaste. It contains the sodium fluoride as well as the stannous fluoride. So this will harden the tooth enamel and remineralizes the tooth enamel and help to prevent the tooth decay. So I never guarantee you that just by using these products will reduce, you will be free from gingivitis or dental decay. This has to be added along with your proper oral care as well as the proper dental visit. So I recommend you to visit the dentist at least once in every 6 months and get the opinion from the dentist, that is which toothpaste or mouthwash will be better for you. Because many of the time my patient used to ask me like, doctor, which toothpaste is good for my mother, which toothpaste is good for my daughter. So without examining your oral cavity, we cannot identify the problem of your oral cavity. So without knowing the problem, we cannot recommend any toothpaste or mouthwash. So like maybe your friend is using one mouthwash that is good for her, but that it doesn't mean that it will be fine for you, because your friend is having another issue and maybe you are having some other issue. So depends upon the problem, you have to select the product. So if you are having a sensitivity and you are using a product that is good for the gums, you won't get a good result. As well as if you are having a gum issue and you are using a desensitizing paste or mouthwash, you won't get a relief from your pain in the gums. So actually you have to, first of all, you have to identify what's a problem in your oral cavity, and depends upon that you have to select the product. So for that you can get the guidance from the dentist. So I would recommend you to visit the dentist and do the proper treatment, as well as along with that, the dentist will prescribe you the proper mouthwash and toothpaste that will help you to maintain a good oral hygiene. So I think this video is very useful for you. Thank you for your support. Please like, share and subscribe. Thank you.